Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. It's a 30-minute daily update on the coronavirus pandemic in Nigeria and across the world. First, some of the highlights. Today, it's a record high of confirmed COVID-19 cases in one day, bringing the total cases in Nigeria to 782. Fears in Kano over allegation of rising debts. Now, the nation continues to witness a growing number of coronavirus cases in the country. The Nigeria Center for Disease Control, NCDC, confirmed 117 new COVID-19 cases yesterday night. 59 of the cases are in Lagos, 29 in Abuja, Kano 14, Borno 6, Katsina 4, Ogun 3, while Rivers and Bauchi states have 1 each. As of now, the total number of confirmed COVID-19 cases in the country is 782, with 197 patients discharged and 25 deaths recorded. Lagos State tops the state-by-state breakdown, as you can see, with 430 cases, followed by the FCT Abuja with 118. Kano has 73 cases, Osun and Ogun 20, Oyo State has 16, Edo 15, followed by Katsina 12, Kwara, Kaduna and Akwa Ibom. Also, Borno State have 9 cases each, Bauchi 8, Gombe State has 5, Delta and Ekiti have 4 cases, while Ondo Rivers have 3, Enugu, Niger, Abia and Jigawa each have 2 cases, with Benue, Anambra, Sokoto states recording 1 case each. There is growing concern over what most people have described as mysterious deaths in Kano State, northwest Nigeria. The situation is creating fears among residents of the ancient city who suspect that the deaths may have occurred as a result of COVID-19. Media reports say the deaths have occurred in places like Zage, Kano Municipal, Tarauni, Gwale, Kona, Dala, Gwazo, and Shinono, among other areas. At Kofa Muzuga Cemetery, reports say that almost 10 corpses are brought in daily for burial. The state government had imposed a lockdown shortly after the state recorded its COVID-19 index case. However, some medical officers have attributed the deaths now in the state to high blood pressure, malaria, and other disease. But joining us now for more clarity on what's happening in Kano is the Deputy Coordinator, Kano State COVID-19 Response, Dr. Sabitu Shuaibu. Thank you for joining us at this, Thank you for joining us on the program at this time, looking at what we're hearing that's coming from Kano. Can you tell us what you've been able to uncover as to the cause, the number of deaths that we're hearing Kano has been witnessing in the past few days?
Thank you very much for the question. Regarding the issue of deaths in Kano, we have heard about the rumors, and as public health, we try to look into it and to see how we can find the true picture. So in doing that, first of all, we actually activated our teams, which actually went to the cemeteries. What we did is, for you to respond to this, you have to have the data and you have to have the reasons for that. And in the last few days, we were actually able to get the statistics of deaths in all the cemeteries within the metropolis. And that is a limitation. We limited it to the metropolis because of the assumption that about 50% of the Kano population is within the metropolis. And what we got is that in the last 1 week, taken from 19th, the number of deaths in these cemeteries was around 640 in total. So it means that there's a number and there's a figure. But figures don't make sense until you compare them. So we compared that with our national average. The national average for mortality in Nigeria is around 11.6. per thousand, and that translates into a total number of about 450 deaths expected in Kano, in quote. So it means that if half of these are within the metropolis, so what we are reporting of about averagely less than or around 100 per day in Kano, if we compare it with the national average based on this, we will say that there is no increase in the number of deaths that we're having in Kano. However, that doesn't stop there. We said, okay, but we're having an epidemic and we need to investigate further. These deaths can be from any other thing. And it doesn't mean when we're having pandemic, it means all other deaths ceases to be from other causes. No, it means that deaths from other causes, as doctors and experts have been saying, still continued. So what we did now is to put up a system because we have to be scientific. So to put up a system that will check all our cemeteries and now record based on symptoms that led to that death, and also to activate such system within our facilities. Majorly because of this lockdown, most of deaths occur in our major facilities. Because of this lockdown, the most facilities actually prefer to refer to these our major facilities. So we have set this system on, and I can tell you, I can confirm to you that from today on, we will now look at the causes and see. But based on the total number, this is what we had, and this is what we are doing.
Okay, just for a little clarification, you talked about a number 640 deaths in 2 days, and you talked about the average based on your history, 11.6%, about 450 deaths. And you're saying that there's no difference if you put the figure of 100 per day. Are you saying that these deaths are normal in terms of what we've been hearing, in terms of the places that you've been to and the cemetery? And also, can you tell us if any of the bodies have been COVID-19 tested for COVID-19?
What I said is that 640 in the last 1 week, not 2 days. Last 1 week, not 2 days. Last 1 week, not 2 days, retrospectively. I'm saying based on last 1 week, and that led to that average I said about 100 from the metropolis only. And minding you, only 50%, around 50% of the population are within the metropolis. So comparing that with what we have, we can say, one, that definitely there are deaths going on. That one is true, there are deaths going on. Then secondly, there are deaths going on from normal deaths from other causes. Then two, we're saying that we are now putting a system to investigate these deaths to see whether it is from COVID. But then currently, there seems to be no relationship between increase in number, which doesn't exist based on this our prelim study. We are not saying this is the final study. We are saying this is a prelim study. And in situations like this, you need to make a quick assessment. We don't wait to say that we want to have exact this and that. No, this is based on a quick assessment, which is going to continue. As I said, a system has been put in place to make this continuous.
Right. I'd also like to ask you about the Nigerian Medical Association, especially the branch in Kano. They're saying they're not members of the COVID-19 response team. Can you clarify that and tell us why we do not have a medical doctor on that team? And also, can you confirm that at the Dandolo Cemetery, no fewer than 40 corpses have been reportedly buried there?
So the first one, saying that there are no doctors on the task force, I think, you know, I am a medical doctor, and I'm part of this right from the zero. So, and I think we can't say there are medical doctors. And then not just me with the state, I think this task force has about 5 members from the teaching hospital, including professors. Renowned professors of infectious disease and public health. They are from the Kano Teaching Hospital, and they are fully part of this task force. And then from us, I think I can say that there are more than 15 doctors in this task force. So I cannot confirm what they said, there are no doctors, but I can confirm to you that I'm also a doctor and I'm part of it.
You're part of the
And then
Nigerian
the
Medical
second part you
Association,
said,
okay?
Definitely, I'm part of the Nigerian Medical Association. As a doctor, all doctors are part of NME. All of us, I'm part of NME, and I'm proud to say that I'm part of NME, and I was a former official of NME in Kano State. So the second part you said concerning to confirm that, as I told you, we have put up a system, and what I told you is the prelim of what transferred in the last 1 week. And later in the day today, we'll bring out this segregation and the details of this our little survey. This our small survey that we conducted based on each of these cemeteries and the segregation in terms of gender, in terms of other data that we got from that. So I can say that saying 40, it might mean in a day or in 2 or in, so it depends on what you mean by that. Definitely deaths are going on. Definitely deaths are going on from other causes, and they may include COVID. Mark my word, they may include, and which is what we're investigating. Thank you.
Okay, more about this investigation of the corpses. We also know that you have a large Muslim population, and the dead is usually buried in a number of hours or just a few days. So how successful are you with exhuming these bodies and trying to test for COVID-19?
So the system we set up means that, one, because of our environment, we do bury corpses immediately. So one of the criteria we constitute is that at the facility, anybody that died from a suspected case, the body should be delayed and should not be released to the family, so that this investigation will take place. Then secondly, for those that might not died in the facility or maybe at home, and you might end up just reaching to them at the cemeteries, for those ones we have set up officers. What they will do is to take data from them. What is the cause of death, how old is he, this and that, and then including the symptoms. And anyone that symptoms look similar to what we expect from COVID, then we go and visit them and we take samples, including from his close contact, and we consider them to be contact of a probable case.
My final question, sir, is that do you think that the COVID-19 response team in Kano can adequately curtail the spread of COVID-19 in the state?
I can confirm to you now that the task force in Kano, it's on their feet, and they are doing all what is necessary. And not just that, what we are having now all over the country, the fight against COVID-19 is not just for Kano Task Force and the Kano Response Team. It's for everybody, and it includes the NCDC team who are on ground in Kano. It includes all our partners who are up and doing to do that. And it also includes even the populace in terms of passing the right information and trying to observe the needful stay at home and lockdown. So I can say that if we continue on this phase that we are, with all the support we are getting from even the populace, I think we are on the track.
Your time, Deputy Coordinator, Kano State COVID-19 Response, Dr. Sabitu Shuaibu. Thank you for joining us on the program. All the best. When we return, we have more updates with regards to preparations of other states and curtailing the spread of COVID-19. To join us again. Welcome back. In the meantime, the chairman of the Kano State Medical Association is warning against making a hasty conclusion as to the cause of the deaths in Kano State. For him, it cannot be certain if the cases are COVID-19 related because proper tests have not been carried out. Dr. Sanusi Bala was speaking on our breakfast program, Sunrise Daily.
Whether we like it or not, we have to believe the cemetery attendants and the undertakers, because there is no mechanism to which the government is keeping vital statistics. And if you want to argue, you have to argue with statistics of your mortality, but we don't have that. So, and false reassurances are not what we can accept at this stage. What it needs to be done is that, as a matter of urgency, is to get these statistics right and then monitored, and then we look at it, analyze, and we take action.
Wait, does that suggest then that the figures that the state governments are putting out about either total confirmed cases or total death cases should be revised?
You cannot revise that based on the mortality, because there are no tests done on those cases to confirm whether they died because of coronavirus or not. This figure that was given, if it's true by the undertakers and the attendants of the cemeteries, then definitely something is happening, and as we have said earlier, it must be investigated.
Over in Edo, as measures to prevent the spread of COVID-19 in the state, the government has started the arrest of some violators of the 7 p.m. to 6 a.m. curfew. 28 offenders were arrested within divisions in Benin Metropolis on Monday, the first night of the curfew. The State Police Command insists that the directive will be strictly enforced and advises residents to comply or face the consequences of their actions at the mobile court. Joining us for more on more strategies to flattening the curve and the rising figures is Dr. Bakia Yusufu, a medical officer in Isolo, Lagos. We'd like to welcome you to the program.
Thank you for having me.
I'd like to get your thoughts on perhaps, the news coming in from Kano, news of allegations of death, and then you had the clarification from the deputy COVID-19 response team in the state. What are your thoughts on what's happening? And seeing also that Kano is recording more cases now. We have 73 confirmed cases of COVID-19 there.
Well, considering the current situation and pandemic of COVID-19, I think deaths in such large numbers really have to be investigated as a matter of urgency, because we would not want to give that position whereby people are just being exposed unnecessarily to this disease. And so it's best, they treat it with such urgency.
And that's also another area the NCDC DG has talked about, the processes, the logistics, and the process of taking the samples also for testing and getting that right. But let's come to Isolo, where you operate. Tell us about what's happening there and the healthcare facilities there.
Okay, presently in Isolo LCDA, we are actually undergoing what we call the active case search now, both the society-based, that's the community-based, and facility-based. So presently what we do is to go to private facilities and check through their records for any cases of cough, difficulty in breathing, and sore throats, symptoms that are similar to that of COVID-19 in the previous month, and then follow them up and see if there has been any improvement and if there's a need for testing for them. Also, on the community-based surveillance, we have volunteers who have been going to, door to door and asking these questions, whether we'd find those who are sick or those who have actually died for some reasons we do not know, and get their information and also try and see if we can test them for it. Then we've been doing an ongoing contract tracing right from the day we had the first case. Because of the proximity of the local council to the Muritala Mohammed Airport, we have had to be on our toes at all times to ensure that we don't have high numbers of confirmed cases in Isolo LCD.
Well, we have some of the positive cases coming from the local government.
Well, presently, because it's an LCDA, we just have some 2 or 3 confirmed cases. But they are doing well, and we're glad that we haven't recorded any deaths from it.
How favorable has the case searches been? What successes have you recorded? Have people been receiving you know, members coming in to check and ask these questions?
Yes, we've been having mixed feelings about our community case search. For some members of the community, they do understand and appreciate the extent this disease has to be checked, and they welcome the volunteers. But on some other hand, we have people who are quite hostile to the volunteers, and they end up chasing them out of the streets of their houses, and that's kind of, you know, makes it difficult for us to actually achieve what we intend to achieve. But
so in areas like that, what's the next thing to do going forward?
Because we already have a team that has been put in place at the local council level, is the emergency preparedness team. So once we have responses, such responses, we just go back to the team and strategize on how we can actually go back there and speak to them and make them understand that, look, we need to have this case search done. And sometimes they oblige, but sometimes it's we're being met with a lot of violence at the end of the day.
So we're also looking at a case maybe that some parts of society might also have this stigma about what COVID-19 is, or perhaps it's a lack of proper sensitization, do you think?
Well, I could say the awareness, it's still a bit low, because people aren't believing that we have COVID-19 cases recorded amongst us. But I believe if we kind of are more open, especially at the community level, based on community cases that are actually being recorded, and they are being, you know, broadcasted to them, probably they might think it's real, because they still have this belief that it's not real, and then we're just formulating some things that are in there. But I think with that, and also if we have people who have actually been cured come out to actually talk about it, it will reduce the level of stigmatization that we see from this.
All right, we appreciate your time, Dr. Bakia Yusufu. Thank you for joining us on the program.
Thank you for having me. Thank you.
States across Nigeria continuing to work out measures on curbing the spread of the COVID-19 pandemic. Let's start in Adamawa State, where the state coordinator of the Social Investment Program described the federal government's initiative as the best thing to happen to the vulnerable and poor in the state. The state coordinator remarks were made during the disbursement of about 339 million naira to beneficiaries of the program in the state. From Lafia, Nasarawa State, violators of restrictions imposed by the state government to contain the spread of coronavirus will not go unpunished. Words of the State Commissioner of Police, Bola Longe, after a stakeholders meeting. According to him, over 400 persons have been arrested. The police says it will not hesitate to arrest more, no matter how highly placed. In Sokoto State, the COVID-19 response team has deployed medical experts to begin the tracing of all contacts associated with the index case discovered in the state. Chairman of the response team and State Commissioner for Health, Dr. Mohammed Iname, assured that all those that have made contact with the patients will be traced. The Oyo State Governor, Seyi Makinde, has appealed to the Nigeria Center for Disease Control, NCDC, and the World Health Organization to help with the certification of the IITA laboratory as a diagnostic center for COVID-19 in the state. He made the appeal during a courtesy visit by the NCDC management and WHO officials. And finally, the Oni of Ife, Obade Ogunsi, has promised to donate 72 locally made motorized modular fumigators to all the 36 states of the Federation to support government in containing the spread of COVID-19. The nation will be waiting to hear from the Federal Ministry of Health on what happens next now that the 14-day isolation of the 15-man Chinese team ends today. This will be one of the issues many will expect the Presidential Task Force to throw light on at the committee's COVID-19 briefing. The team of Chinese, comprising doctors, nurses, laboratory technicians, arrived in Nigeria April 8th with the medical equipment worth about $1.5 million. It was an invitation that was criticized by Nigerians, especially the Nigerian Medical Association. And of course, the Nigeria Center for Disease Control says to remember face masks are to be worn in combination, social distancing, hand washing, cleaning of surfaces. The website has all the information, also statistics on cases across states. with regular updates on COVID-19 regulations. It's the same with the World Health Organization. Its website has rolling updates of the world body's strategies and plans. Each moment it keeps updating. You can take a look at some of the numbers in real time. Well, that's our COVID-19 update on Channels Television. Thank you for watching. Another update comes up at 6. In the meantime, we'd like to hear from you at this period. Tweet at us at Channels TV. I'm Millicent Wonka. Bye for now.